In the Western Cape province of South Africa, around 20% of the population will at some stage in their lives suffer from addiction. Despite the alarming statistics, treatment rates remain low. One of the reasons for this is that there are a limited number of people specifically trained to deal with addiction. Fortunately, medical professionals are starting to realize the importance of specialized addiction care.
The Addiction Division is an innovative,
diverse collection of people.
They do research, they do clinical work and teaching,
striving to educate and spread
knowledge, skills and clinical input
towards helping people who are addicted.
Given the prevalence of substance use disorders,
that whole integrative approach really makes the Addictions Division top-notch.
Someone who has benefited from this care is Russel, a Cape Townian recovering from drug addiction.
Growing up, I was a fairly happy child. I lived on the so-called quiet side of Manenberg, but because I was a kid, I never saw the real dangers that was there. One night I woke up with somebody trying to have oral sex with me. I realized that it was somebody that I know, and it was one of my cousin's friends. I was 8 years old. And as time went on, I completely forgot about it because I started sniffing glue and drinking alcohol, and all I remembered was that I feel good when I'm taking these things.
South African children are starting to use alcohol and drugs at a younger age. Drug use in the community, easy access to substances, and absentee parents contribute to this pattern.
From a young age, children are exposed in their own households. Their parents, brothers, cousins are using tik, dagga, heroin in the house. So they're exposed to it and they also learn these behaviors. So they start at a young age experimenting.
Russel continued on his downward spiral, and although at first the drugs seemed to help him cope, he would soon learn the true horrors of drug addiction.
I lost a lot of weight, I felt good about myself, but I soon learned that, drug will get hold of you whichever way you are. I got very paranoid and I couldn't function quite normal. I couldn't look for work. I would find any nook and corner, anywhere it looks like nobody can see me, and I'd smoke there. And I put myself into a lot of dangerous places.
basically there are three distinguishing features of addiction. That is compulsive use or compulsive behavior, which means that a person will use alcohol or drugs compulsively despite experiencing negative consequences. Then there is tolerance, which means that they need increasing amounts of behavior or increasing amounts of the alcohol or drugs. Thirdly, there's withdrawal, which is negative effects which are experienced once they stop using the substance or they stop engaging in the behavior. If a person has all three of those features, then we would say that they're classically addicted.
Eventually, Russel found himself staying at Oudtshoorn, an abandoned psychiatric ward in Pinelands that has now become a home for many otherwise homeless people. Here, Russel hit rock bottom.
So this guy rocks up and I said, I'm cold, all I need is some clothes. So he went inside and he pulled out a jersey and he threw it at me and says, yeah, wear this. And I thought, okay, something warm, but the hardest part was, I guess, when I pulled that jersey over my head, was when, as I pulled it, I could smell only urine. And as I pulled it down, it was like everything that I was, the strength that I had, sunk away with that smell. And I just threw myself on the couch and all I could do was cry. I looked fairly homeless. I was stinking, I had a beard, and that was my lowest point job.
One of the most effective places to pick up addiction problems is right at the coalface, in emergency rooms, at hospitals and clinics. Alcohol and drugs play a role in about 50% of all admissions to emergency services.
The idea is that patients who are injured due to their alcohol use are more likely or motivated to change their behavior because they've seen the consequences of their use.
Katherine has trained lay counsellors to use this as an opportunity to screen possible substance use problems.
The screener that we use is developed by the World Health Organization and allows people to go into sort of low, moderate and high risk. Those at moderate to high risk are then asked to participate in the intervention.
In conjunction with clinical services, Groundbreaking neurobiological research being conducted by Dr. Howells and her team using brain imaging is demonstrating exactly how the brain is being affected by substances such as methamphetamine.
Magnetic resonance spectroscopy, MRS, is a specialised technique performed in an MRI scanner. MRS is a non-invasive analytical technique that can be used to study metabolite changes in the brain tissue. Neurobiologically, the addict's brain chemistry and brain circuitry changes. We need to understand these changes so that we can reverse them or prevent these brain changes from developing. So we've recently completed a study where we've looked at methamphetamine dependence. And we've shown that abstinence from the use of methamphetamine actually improves the metabolite changes that we first found.
Luckily for Russel, a chance meeting with a special woman curbed his drug habit just in time before any permanent damage could be done.
I met Nikki and I told her about my life, but I told her everything, all the horrible details of what I did, and all she did was listen. Driving home, I drove past the merchant's house, still having this Nikki on my mind, and went home just blown away by her. And then soon after that, I decided to book myself into a clinic. I went to Cape Town Drug Counselling Centre, and I told them I want to stop and I need to go through a program.
Despite the high rates of substance misuse in South Africa, treatment rates remain low. For this reason, the division has set up 2 new postgraduate courses, a diploma course and a master's degree.
One of the biggest barriers to treatment in South Africa is the lack of an addiction workforce. And because of this, the University of Cape Town decided to introduce a postgraduate diploma in addictions care, as well as a Masters of Philosophy in Addictions.
So we set up the postgraduate diploma in addictions, which is training people who are currently working in addictions with necessary skills, with education, with information and research skills. And then the second one was to try and provide people with further degrees, in other words, psychiatrists, doctors, psychologists with a master's. So we set up an MPhil in addictions, and that was providing individuals with more skills so they could go and use those skills to teach other people.
The first students to qualify with this new diploma in addictions care received their diplomas in December 2012.
Addiction division is a long overdue addition to the health sciences,
where we've learned for 2 years about how to skill and equip ourselves on how to assist people who are recovering with addiction. More importantly, how to treat the disorder.
And we have incredible lecturers out there who have done this.
This vital contribution emphasizes the important work that the Addiction Division is doing in all areas of addiction.